I think that we all recognize that psoriasis is an inflammatory disease. I think what we all really need to recognize is that it's not just the skin. Psoriasis is associated with a number of other disease states. Today I talked about arthritis, which most of us are aware of, but depression, cardiovascular disease is a really big problem with this patient population. Things like inflammatory bowel disease, and there's a long list of diseases, again, that have an increased likelihood of occurring in this population. And so, as dermatologists, I think it's very important for us to treat the entire patient and to know what our patients have increased likelihoods of having. Not only should they have a primary care physician to help us in monitoring for these disease states, but I think it's really important for us, if we're using systemic therapies, to know what is the most appropriate therapy to give my patient if they may have some of these other disease states. Yeah, it's really tragic. Every year people who have psoriasis die. Many of them used to be from medication side effects, but suicides is actually probably one of the leading causes of death from in a psoriasis patient. That's if you exclude cardiovascular disease, which also is highly prevalent in the psoriasis population. It's estimated that suicidality is higher in the psoriasis population. Perhaps it's in the people with the most severe psoriasis who are in the younger age group. So particularly in that group of 18 to 35-year-olds with significant psoriasis, I've made it a habit to ask my patients about depression and if they've ever had thoughts of hurting themselves. I think it's something that's hard to talk about, but so important. So for those patients, I really feel like I'm the screener, that I should be asking the questions. And then if I'm concerned about a patient, then I'm going to try to arrange to have high quality follow-up with somebody in mental health.